Hello, and welcome to part 2 of ankle and tib-fib anatomy. Let's begin this discussion by talking about more specific anatomy of the proximal tib and fib. So the tibia, as you probably know, is one of the larger bones of our body. You can see it here is the medial bone in our lower leg. And it really bears a lot of our weight when we're in an upright position, so it makes sense that it is a nice and strong and long bone. The tibia can be felt easily through the skin in the anterior and medial parts of our lower leg. So if you run your hand down the front of your lower leg, you are actually feeling this anterior crest, and we'll talk more about that in a minute. The tibia is made up of 3 specific parts. So first you have this long, slender portion in the middle that is the body, and then you have the proximal and distal extremities. The proximal extremity of the tibia contains 2 condyles. And remember, condyles are large processes. You have your medial condyle and your lateral condyle. Above the condyles, you have this intercondylar eminence here, and that's also known as your tibial spine, but intercondylar eminence is the more common term. Within the intercondylar eminence, there are 2 small pointed prominences, and you can really see these when you label our bones in lab, but those prominences are called the medial and lateral intercondylar tubercles. And again, those are located on the superior surface of the tibia between the medial and lateral condyles. And if you were labeling these on an x-ray or on a lab quiz, you could simply call them the intercondyloid or intercondylar eminences. You don't need to label them medial and lateral. That's fine. Now notice on either side of the intercondyloid eminences, there is this flat articular surface. It's rather smooth and almost concave in shape, and that is called the tibial plateau. And we'll take another look at the tibial plateau on the lateral projection in the next slide, but this area articulates with the distal femur to make the knee joint. Now, again, we'll look at this closer in a minute, but this tibial plateau, those surfaces actually slope posteriorly 15 to 20 degrees. And again, they have this articular facet, which articulates with the distal femur. So more to come on the tibial plateau. The tibial tuberosity is in the proximal extremity as well. It is this bump located right here. It is a rough textured prominence or bump on the anterior surface of the proximal tibia, just below the condyles. Okay, and it's important because this tuberosity is a distal attachment for the patellar tendon, and that patellar tendon comes up over your patella and connects to the large quad muscle in your thigh. Sometimes young people will have this tibial tuberosity separate from the tibia, and that is called Osgood-Schlatter's disease, and we'll look at that when we get to pathology. The body of the tibia is, of course, this long, slender portion in between the extremities, and along the anterior surface of the tibial body, extending from the tibial tuberosity all the way to the medial malleolus, is this sharp ridge that we talked about a minute ago called the anterior crest. Again, the anterior crest, or the shin bone as we call it, is right below the surface of the skin, and you can feel it very easily. Remember, the distal extremity of the tibia is smaller than the proximal extremity, and it ends in this pyramid-shaped process called the medial malleolus, which you can also palpate on the medial side of your lower leg. The lateral aspect of the distal tibia is kind of a flattened area that articulates with the distal fibula. Let's take a look at our tib-fib from the lateral. So again, notice the fibula is smaller, and it is the lateral of the 2 bones, and it sits posterior to the tibia, and you can really appreciate that here. The fibula articulates with the tibia proximally and the talus distally. So pretend the talus was sitting here. The fibula articulates with the talus and the tibia. The proximal extremity of the fibula is expanded. See, it's slender here and then it kind of expands at the proximal end. And it expands into this head region. The fibular head is proximal and it articulates with the lateral aspect of the lateral condyle of the tibia. The extreme proximal aspect of the head is kind of this pointed region, and that's called the apex of the head of the fibula. It kind of looks like a little finger pointing upward. The tapered area just below the head then, where it kind of gets narrow again, is called the neck of the fibula. So just to recap real quickly on the fibula, the distal end is the lateral malleolus, and again you can palpate that on the lateral side of your lower leg. The proximal end is the apex, head, and neck. Good. Okay, so I just want to point out a few other structures that we talked about on the AP view. Notice this bump right here. This is your tibial tuberosity. And it's not labeled here, but again, this is a bump on the proximal part of that anterior crest. Okay, and that can be a spot for pathology, so it's kind of an important spot for us. Remember, that's where the patellar tendon attaches. And then I also wanted to point out the tibial plateau. Notice these articular surfaces or facets that articulate with the distal femur. Remember how I said they slope posteriorly 10 to 20 degrees? Well, you can see that very nicely here. Okay, so I wanted to point that out before we move on. All right, so here's some anatomy. So I want you to pause here. And I want you to see if you can identify all of the structures on the AP tib fib and the lateral tib fib. And then I've included the answers for you in the notes section of this presentation. Okay, as we conclude this presentation, remember, all of the joints of the lower limb are synovial and diarthroidal. Remember, synovial is the structural classification, diarthroidal is the functional classification, and it means that all of the joints are freely movable. Remember, there is one exception to this, the distal tib fib, so where the tibia and fibula articulate. That is not a synovial joint, that is a fibrous joint, and it has amphiarthroidal movement. It's only slightly movable. By the way, it is not noted here, but the ankle joint is considered a sellar or saddle joint. And there's certainly a chart in your textbook that has a summary of all the classifications of movement types for the joints of the lower limb. Okay, if you have any questions about any of the anatomy, please let me know. Certainly we'll be labeling all these bones in lab, and hopefully that will help you become familiar with the anatomy. Thank you.